First of all, there are lots of social prescribing projects going on where we're learning loads of things. This is quite new. Although the principles have been going on for 20 years, it's never been formalised as it is now. And I think the thing to recognise is this is actually just part of a bigger package that GPs will have to be able to use to get patients back to health. We know that medication is not going to deal with obesity and it's not going to deal with curing diabetes, it can manage it. Depression, anxiety, Parkinson's, a load of things that we can do with medication, but we're just controlling the condition, whereas social prescribing can actually prevent it and even reverse it. So this is part of the process of normalisation of healthcare, so that it's not just medicines, it's just not operations, it's not just doctors, but you've got a professional like a link worker. So we need to train them up, we need to learn about what's going on already, look at the evaluation, making sure there's cost effectiveness in it, and then we start to roll that out, and then those 1,000 new link workers will be recruited over the next 2.5 years, so that actually 2.5 million more patients will be engaged in the next few years. It's new, so there are going to be barriers, and I think the barriers are both from the medical profession but also for patients as well. So you can get a doctor who's really enthusiastic about social prescribing and will refer a patient, and the patient says, well, I want to go to the hospital and have an operation to sort it all out. I don't want to start doing things differently. So what we have to look is outcomes. So the NHS may be able to deliver one outcome with what it's got available, but actually social prescribing improves the outcome. It makes it much, much better. And that's what we've got to focus on, is what can it actually achieve? And then there's the actual barrier from some of the medical profession to say, is this cost effective? I haven't got time to deal with this kind of thing. My professional is to deal with what I'm good at as being a doctor. And I would say, absolutely, I've been a GP for 25 years. I love the job still, and I enjoy really working with patients to get them better, but I know I've got a limited armoury of things I can do. The relief is I can refer them to someone who can then take them forward and do a lot more with that patient, which I can't do, and achieve outcomes I can never ever dream of, which they can do, which I can't.